My name is Dr. Olukemi Akanle. I'm a consultant psychiatrist, and I'm also the clinical director in CNWL NHS Trust for Brent Mental Health Services. Actually, it was my mom that chose the profession for me. I remember not really having an idea of what I wanted to do when it was that time to go to university. And she suggested medicine because she was like, it's universal. You can work anywhere. You can work with different types of people, different types of patients, which seemed quite interesting, having that, mix of different people coming through the door. So I kind of thought that's a good idea and applied and got in, and that's how I got into medicine, really. It was my mom's choice. So psychiatry, on the other hand, was definitely my choice. I remember we did, so I went, my undergraduate training was in Nigeria, Lagos, Nigeria. And the way it works there, in between all your clinicals, you have 1 month of psychiatry, a posting in the psychiatric hospital. And I remember that 1 month being extremely eye-opening. It was interesting. There were just so many different cases coming with different situations, different scenarios. And I just remember listening to each patient and each time thinking, wow, this is amazing. And then they needed volunteers at the end of the 1 month to present the cases we've seen. And I was the first person to put up my hand. I was like, I'll do all the write-ups, I'll write everything, because I really, really enjoyed myself. And then fast forward to when I did finish my house job, and it was like, okay, fine, I need to choose a specialty. And I just remember thinking I didn't enjoy pediatrics, I didn't enjoy obs and gynae, didn't enjoy medicine, didn't enjoy surgery. And I found myself thinking, what am I going to do? And then I was like, actually, that 1 month of psychiatry that I did about 2, 3 years ago was still in my head. And in my country, you have to do a year of what we call youth service. So if you're a doctor, you work in a hospital. If you did education, you'd go and teach. If you did finance, you'd work in a bank. So I spoke to my mom, who worked in the Ministry of Health at the time, and said I wanted to do my youth service in a psychiatric hospital, the one in Lagos. So she got me into that. And I said to myself, if at the end of 12 months of psychiatry, I'm not enjoying myself, then I probably have to leave medicine or something. But at the end of 12 months, it was all the more reason for me to want to do psychiatry. I was like, I'm definitely pursuing this as a postgraduate degree. And that's how I got into psychiatry. So I think a lot of times it's seeing people come in one way, whether they're depressed or anxious, or even some patients that have psychosis, and with the right treatment, whether it's pharmacological, psychological, they get better and they're able to go back to their lives, whether it's work, school, family. And it's quite rewarding to see that, and you can see the relief on their families' faces when things get better and that they're able to go back home and able to get back to business as usual. And to me, it's kind of the fact that you had a hand in getting those people to that point where they can get back into society and function again. I find that really rewarding. It's, I mean, although in psychiatry you do have a few chronic cases that it's difficult to treat or they lack insight, but majority of people, you can see the difference with the right kind of treatment and the difference it makes to them, the difference it makes to their families. And to me, I find that really rewarding. It's kind of what keeps you going at the end of the day. So I would like to think that my patients value the fact that I'm approachable. I listen, and I try and meet them at their level. So I think it has to do with my background of working back at home in Nigeria. So in Nigeria, a lot of people don't necessarily come to hospitals as their first port of call. They'd go to churches or, native doctors. And by the time they come to hospitals, it's kind of like you're their last resource. And a lot of people are very religious minded, and they have their beliefs and various things. And in order for treatment to work, you have to meet them on their level. So I remember back then, a lot of things we used to say was like, I'm not telling you not to pray, I'm not telling you not to have your beliefs, I'm just telling you to do that and take a medication at the same time. And I think that's carried on throughout my work as a psychiatrist, even though I'm no longer in Nigeria. Here as well, different people have their different opinions and different beliefs, and I try to get them to understand where I'm coming from. I kept trying to understand why they are, that way inclined. And hopefully we can come to an agreement, because that's the best way to get the person to take their medication, to believe in you as a doctor and believe in the treatment. If you're trying to impose your will on theirs and disregard their beliefs, then it's not going to work. You have to take on board what they believe, what their family believes, what the patient believes, and try and understand why that's the case. And sometimes you learn from patients as well. They might come up with something that you didn't think about and think, oh, okay, that's not a bad idea. We can try and collaborate and see the best way to get things forward. And what I also like in patients is, um, there's this thing about confidentiality, and I think sometimes people misconstrue what confidentiality is. So um, I've seen doctors get it wrong, and families would come and ask about their patients, and they'd be like, "I can't tell you anything." And I try and explain to my junior doctors that, fine, maybe the patient has asked you not to tell them anything, but you can listen to what the family has to say. So, because you never know what the information the family is going to give you that will help with their treatment. So I'm like, don't stonewall, don't block them, listen to what they have to say. And you can also give some information in the sense that he's doing okay, or she's getting better, or we're trying to do the best we can. You can give some kind of vague information that can reassure them. But what I find unhelpful, I mean, if I were on the other side, is if I went to see my doctor for my relative, and they told me, I can't talk to you, that's just going to make me even more anxious. So I would like to think that for my patients, I'm somebody who listens, I'm somebody who tries to take on board what they're trying to tell me. And also, yes, I understand there's some information I can't share with you, but I can share general information about the person is getting better, or the person is okay, or we're doing the best we can. Anything just to reassure you and make you feel better. So yes, that's what I hope my patients will like about me. Oh, definitely don't have any catchphrases. Mantra, again, I think just do the best you can. As long as you've done the best you can, I think you can go home and say, look, I tried my best. I did everything I could for my patients. And I think yeah, I would say that's probably my mantra, but I don't have any catchphrases, no.